Hi, Mr. Massey. I'm Carrie. I'm going to be the nurse today. I'm going to do your head to toe assessment. I'll have you come up over here and have a seat. Okay, good. I'm going to wash my hands. Okay. Start out by giving me your full name.
Scott Charles Massey.
Your date of birth.
7/26/66.
And today's date.
November 30th, 2014.
Perfect. I'm going to start by just looking at you and observing. Make sure everything's symmetric. I can give you 5 facial expressions. Can you smile? Pucker up your lips. Puff up your cheeks. Wrinkle your forehead. Close your eyes. Perfect. Okay, I'm going to start touching on you. Make sure there's no lumps or masses. Do you notice any?
No.
Okay. Touch your ears. Any drainage?
No.
Okay. If I had an otoscope, I would look at your tympanic membrane, make sure it should be pearly gray, translucent, and no perforations. I'm going to come behind you, I'm going to whisper, and I want you to repeat it, okay?
Hello? Diamond?
Perfect, okay. I'm going to start touching on you right here. Any tenderness?
No.
Up here?
No.
Okay, perfect. Now look at your nose. Notice any drainage through your nose or anything like that?
No, sizes.
Okay. Alright, have you open up your mouth, please? I'm just going to start by counting your teeth. You have exactly 32 teeth. Keep your mouth open. I'm going to stick this tongue depressor in it. I'm going to feel around your hard and soft palate. Any tenderness or anything? Okay, if you stick your tongue out, I'm going to do gag reflex. Okay. Sorry about that. If you could, take your tongue on the side of your cheek and push. And on this side. Okay, I'm going to go to your jaw if you could sit up. Alright, open. In and out. Okay, and then side to side. Okay, don't feel any popping or anything. Alright, I'm going to come back and I'm going to feel your lip nose. Any tenderness? Come behind your ear. You could just lift your head up just slightly. I'm going to feel your thyroid. Can you swallow? Okay, perfect. Alright, I'm going to come back up to your eyes. First, I'm going to have you follow this pen light. Okay, perfect. I'm going to have you cover your left eye while I cover my right. I'm going to test your peripheral vision. If you can tell me when you see my hand come across.
See it.
Okay. Your other eye.
I see it.
Okay. Perfect. You can keep that one. I'm going to have you cover one eye. If you could focus on an object in the distance. And remove that. Okay, we're going to do the other eye. Focus on an object in the distance and remove. Okay, perfect. Thank you. Alright, now this is where I'm going to shine your light. Shine the light in your eye. Just look straight. And do your other eye. Okay. Perfect. I'm going to let you put something on your face and let you know if you feel it.
It feels like a feather or a cotton ball.
Perfect. Tell me if you feel this.
Yes. Yes. Yes.
Keep your eyes closed. Can you identify that?
Coffee.
Hold your arms in your hand, please. I'm going to write some letters. I want you to repeat the letters.
A. E.
And I'll also put something in your hand. If you could tell me what it is, you can touch on it.
It's a small coin, a penny, or a dime.
Okay. Perfect. Thank you. Okay. I'm just going to have you shrug your shoulders. Okay. Get some good muscle strength and start touching on you. And your tenderness.
No.
You could hold your arm like so. As you're holding it, the longer you're holding it, do you have any numbness, pain, or tingling in your wrist?
No.
Okay, perfect. I'm going to check for another muscle carpal tunnel. Pain, numbness,
No.
tingling? What about this one?
No.
Okay, perfect. While I'm up here, I'm going to go ahead and, if I didn't have my hammer, I would go ahead and get your deep tendon reflexes, which would be your brachioradialis. I would do your tricep, your plantar, which are their patella, which I'm pretty familiar with, and then also your Achilles. Okay. I would want to see a slight movement, what we would rate as a 2+, which would be normal. Okay. All right, so I'm going to be touching on your chest. Okay. I'm going to come back around your spine. Any tenderness?
No.
Seeing if it's symmetrical. 99?
99.
99?
99.
Take a deep breath. Perfect. I'm going to be hitting on you a little bit. Tell me if you feel any pain.
Okay.
Pain?
No.
What about this one?
No.
Alright, I'm going to look at your neck. Can you pull your neck completely forward, backwards, side to side? Okay. Can you turn your head and put resistance? Okay. Other side. Okay. Can you push up against my hands? Okay. And can you lift this leg up? Okay. And then this one. Okay. I'm going to go ahead and touch your legs. Any tenderness?
No.
Pain? Okay. Perfect. Alright, I'm going to go ahead and start listening to your lungs. I'm going to start on your back. You just breathe normal. And start your neck. I'm going to come back down this middle. Here on this side. And go ahead and listen to your heart. Got my stethoscope on. I'm going to go ahead and listen to your birds here. Just your heart sounds again. I'm going to get a blood pressure. Relax. And pump it up pretty high. And 22 to 80. Pretty good. Okay, I'm going to go ahead and get your pulses. I'm going to come back up here. I'll get your other pulses when you're laying down. I can have this again. We got a pulse of 67 and a respiration of 15, which is good. One more thing, I'm going to test your range of motion of your wrist and your fingers. So if you could take your wrist, come in, out, circular motion, clench your fist, fan out your fingers, touch every thumb. Okay, perfect. And if you could touch your index finger to your nose. Perfect. Alright, that's it for part 1. Okay, Mr. Massey, for this next part, I'm just going to look at your stomach. First, I'm just going to look at it, make sure it's symmetrical. Get your Look at your contour, your skin color. Looks good. I'm just going to keep that shirt up. First I'm going to listen.
Okay.
Gotta get a little low here. Turn it around. And a little lower. Okay. Turn the bell around and listen a little up here. Go a little lower. And a little lower. Sounds good. I'm just going to start touching on you just a little bit. Pain, tenderness.
No.
Okay. Now I'm going to start hitting on you a little bit.
Okay.
I'm going to get a little deeper.
Okay.
You tell me if I'm causing any pain.
Okay.
Get your bladder. I can feel it. Okay. While I'm down here, I'm gonna get your inguinal nose, your lip nose.
Sorry, it's ticklish.
Alright, I'm gonna move down here. Check your pupil pulses. Very good. And very good. Alright, I'm gonna take your foot, just relax it. I'm gonna move your foot up towards the ceiling. You tell me if there's any pain in your calf, okay?
Okay. No pain.
Okay. I'm gonna do it again, but a little faster. Okay. Do it this next one. Just relax. Pain?
No.
Okay. Do it a little faster. Perfect. While I'm down here, I'm gonna go ahead and check your cap refill. Okay. And your fingers. Your other hand. Alright, perfect. Okay, while I'm down here, I'm going to check the range of motion of your hips.
Okay.
With this leg, can you go straight up with it? Perfect. And back down towards me. Perfect. Can you bend at the knee? Alright, and lift it up. Can you lift it over your other leg? Perfect. We're going to do the other leg. Straight up. And back down. Over. Other way. Perfect. And then we're going to bend. And then come towards me. Perfect. Alright, I'm going to do your ankles too. Poke your toes up toward the ceiling. And back down. Inward. And kind of outward. And you can curl your toes. Okay, perfect. Perfect. Oh, I'm going to get at your head. I'm going to lift up your head just slightly. Tell me if there's any pain in your neck. I'm going to check for nuchal rigidity.
No, no pain.
Okay. I'm going to come around here. Take these pillows. Get your head about 45-degree angle so I can check for JVD. I do not see it. Just good. I'm I'm gonna let your shirt up just again. See if I can visualize your PewDiePie. Okay. Thank you. Okay. I think that I am done. You can sit up if you'd like. The last test that I would have performed, I didn't have the equipment, would be the Weber and the Rhine test. That's that tuning fork, the big fork that you've probably seen.
Right.
To check your hearing, I would strike it, put it at the base of your head right here, and ask you how you hear it throughout both ears. You should hear it symmetrically, evenly throughout both ears.
Okay.
Next, for the Rhine test, I would strike it again, put it right back here on your mastoid bone,
Okay.
and whenever you do not hear it anymore, you would tell me.
Okay.
I would take it about 1 to 2 centimeters out by your ear,
Okay.
and you should hear it twice as long.
Okay.
Okay? The last test I would have performed, but I don't have, would be the check your red reflex. That would be with the ophthalmoscope. I would put on the highest setting, which would be the biggest point of light. I would kind of get with you at an angle. You would stare off at something, and I should see a red reflex right there.
Okay.
Entirety of your eye.
Okay.
If I didn't, it would be black or anything like that. That would be an obstruction somewhere in your eye, and I would give you a referral for that.
Okay.
Okay? Any questions or anything?
No.
All right, perfect. Okay, Mr. Massey, for our last part, I just want to observe you. If you could close your eyes, you're going to observe your gait. Can you put your feet together? Put it together. Okay. I'm going to notice any swaying back and forth. Okay, perfect. Alright, you can open your eyes. And for this part, we would normally do a Snellen eye chart test, which you would stand 20 feet away from the chart. I'm sure you've done one of those before. You would test each eye both individually and then both together. You should be able to read at the 20/20 marker, and if you do not, if you aren't able to read at the 20/20, then we would give you a referral. Okay? I want to see the range of motion of your lower back, which would be your lumbar. So if you could go forward, okay, and backwards, to the side, to the other side, and then a circular motion. Okay. I'm going to do your shoulders. If you can go straight out and back down, straight up and back down, straight out and back down. You're going to go behind. Perfect. You can go with each one, go across, back down, across. If you could take each one and go like behind, perfect. And the other one. Okay, then I'm going to do your elbows. If you could just go straight, bend, okay, go back down about 90 degrees, and if you could rotate. Perfect. Okay. Next I would like to put your shin to your knee and scroll down. Perfect. And the next one. Perfect. And then you could do some heel to toe walking. Alright, perfect. I think that's it.